Hello everyone, Assalamu alaikum. After the response to my previous video, which was made on checking the authenticity of your N95 respirator, whether it is a fake or an original respirator, I got many queries related to the use and reuse of your N95 respirator. So today I will be demonstrating to you how to use an N95 respirator, because one thing which is very important related to an N95 respirator is that if you don't use it properly and if it is not fitting properly on your face, it does not provide you the 95% efficacy which it is guaranteeing to you. Take your respirator in the cup of your hand and its headband should be hanging downwards. Slip in your hand down the respirator and take it to your face. Adjust it on your nose and mouth and take the upper headband and keep it on the top of your head. Then take the down band and put it down of your upper headband. Now adjust your mask on the face and with your both hands mold the nose clip around the bridge of your nose. Then adjust the face respirator again, and now we will be doing a simple fit test. For a fit test, you just have to exhale very strongly and the mask should puff out like this. And while this, there should be no leakage around the sides of the mask. Now the second part is you need to inhale strongly and the mask should pull in towards the nose and mouth of your face. Like this, it should pull in. And there should be no leakages which you can feel around the seal of the mask. If it is not happening, then and there are some leakages around the edges of your mask, you need to adjust your band. The second method is that keep your upper band down and your lower band up so that there is a formation of cross on your side of the face. There should be a formation of cross at the side of your face. This fits the respirator more properly as compared to the first method. Again repeat your fit test and check for the leakages around the edge of the mask. So there are, I cannot feel any air leakage around the edge of your mask. So this way it is fitting perfectly on my face. If after doing these two methods also your mask is not fitting properly, you are feeling leakages around your edges, please do not enter the COVID area or the close compact spaces with such kind of respirator. Maybe you need to change the brand. You can shift to some other brand, because this molding is not proper for your face cut. So you can go for some other brands where the respirator can fit your face properly. But remember, without passing the fit test, you should not enter a COVID care area. The second query which was put across is that how to reuse an N95 respirator. Can one wash a N95 respirator? No, one cannot wash a N95 respirator because it damages its efficacy. But there are some other ways by which we can reuse an N95 respirator. As per the guidelines, certain methods have been authenticated for the reuse, but the best possible method which is good to use at home is that what I am going to show you today. Due to the very high demand of N95 respirators, and because of which there were deficiency in the supplies, and also the cost of N95 respirator, which is comparatively costlier than the surgical mask or the cloth mask, the reuse policy of the N95 respirator became a very important aspect in this pandemic. So today I am going to show you a very cost effective method of reuse of the N95 respirator. You just need 5 paper bags for it, and you need to take your respirator without touching the front part of the respirator. You need to keep it into a paper bag. Why I am telling a paper bag and not a polythene bag is very important. You only need to keep the respirator in a paper bag, because if you take a polythene bag, it creates a very humid environment inside, and which helps in the growth of different bacteria and fungus that can lead to the secondary infections when you will be using this respirator after 5 days. So using of only a paper bag is very important for the reuse policy. So after putting, we are going to staple it and keep it aside. Similarly, we will be putting the second day respirator in a second bag and labeling it as day 2, third day respirator as day 3, fourth day respirator as day 4, and then the fifth day respirator as fifth bag, and stapling them all. Then after 5 days, we can again take out this respirator from the day 1 and use it, and now as of now it will be 5 days and the viral load inside the respirator has already dried up, and it is considered that the virus must have already died and it is safe to use. So as per this policy, you need to purchase 5 N95 respirators. After using them for 5 days, again you can use them in 5 cycles. That means for 5 cycles for 25 days you can rotate these 5 N95 respirators. So around for 1 month 5 respirators are going to suffice you. So this is the easiest method available for the reuse of the N95 respirator without any harmful effects. I strongly recommend all the frontline workers, especially the doctors and nurses, to use N95 respirators when they are going for the care of the COVID patients. For the general public, I would recommend to use a N95 respirator or a KN95 mask if they are going to a closed space, especially in the airports and the air travels. Apart from that, in crowded places, if they cannot use N95 respirator or KN95 mask, because some people feel laborious breathing because of that, and it is not feasible for them to use that. In such cases, they can use double masking. For that, they need to use one surgical mask and one cloth mask. They have to pair 2 masks, and I hope this video is beneficial for all those people who had raised the queries, and I will strongly suggest everyone to mask up to stay safe. Till next video, thank you for watching. Allah Hafiz.